Welcome to L5 Education Hub. You aim to become a resource for mastering Level 5 health and social care assignments. Our channel is dedicated to helping students excel in their studies by providing comprehensive tutorials, assignment writing tips, feedback utilization strategies, and much more. Join our community of learners and take your education to the next level. Yes, this channel is new, so please subscribe and hit the notification bell to stay updated on our latest videos. Let's achieve academic success together. When discussing assignments, we refer to the units in your course, specifically from Unit 1 to Unit 29. Stay tuned so you don't miss any videos. We will show you how to write the assignment for each unit. And the great news is that you can scan the QR code to download the assignment for the unit you're working on. Just look for the QR code pop up during the video. Remember, using your own words for your assignments is essential, as our content is reserved, copyrighted, and protected. Welcome back to L5 Education Hub. Today's video will dive into the essentials of writing a high-scoring Level 5 health and social care assignment. Whether you're struggling with structuring your essay or looking for tips to impress your students, we've got you covered. We hope you enjoy the assignment that starts now.
Unit 10, DILMAC 5C Continuous Improvement in Adult Care. Led Continuous Improvement in Practice. 1.1 Monitor and evaluate progress towards the achievement of positive outcomes and the implementation of person-centered practice. 1.2 Listen to the views of individuals and carers about the care and support the service provides. 1.3 Use evidence-based research to identify best practice in outcomes-based and person-centered practice. 1.4 Identify and act on lessons learned from incidents that occur. 1.5 Review the extent to which systems, processes, and practice facilitate positive outcomes. 1.6 Plan for and lead the implementation of improvements to systems, processes, and practice. 1.1 Monitoring and evaluation of the progress towards achievement of the positive outcomes and the implementation of person-centered practice. Evaluation and monitoring of the progress in the positive outcome and the implementation of the person-centered practices in adult care require consideration of result-based accountability, which is also known to be outcome-based accountability and uses the process of data-driven decision-making that help in the problem-solving and the way of acting and thinking which improves the overall life of the community. The result-based accountability is also important as it enables in improving the performance of the services within the organization and supports the management of the outcomes, which helps the adults within the adult care home and the patient in making the related choices on the basis of the impact associated to the knowledge that required the consideration in the improvement of life of the patient. Tillmouth and Quallington, 2016. The evaluation and the monitoring of progress require the implementation of the logic model, which is the logical theory and the framework associated with the change which is used by the evaluator manager and the fundamental in the program to consider the outcome-based practices in order to focus on the immediate situation and also supporting the requirement that can be provided by the care professionals. The idea associated with the outcome and its requirement in person-centric care is essential as it focuses on the achievement of long-term, medium-term as well as immediate goals and undertakes the target-based approach by setting review dates and monitoring that achievement in health and social patient care. 1.2 Views of the individuals and carers about the care and support the service providers. The support practitioners in their strategy of continuous improvement in the patient care request need to the identification of the learning need and carry out appropriate strategy with the use of coaching and mentoring. Clutterbuck, 2011. The health and social care and service which is needed require an effective partnership between the organizations and the different professions which are involved in the delivery and commissioning of the services as well as the intervention and which requires a shared system of communication, including the record database and the files for ensuring that the consistency in the care is being maintained as well as in the process of the decision-making. Under the CARE Act 2014, support and care are brought about by improving and simplifying the already existing legislation of care and the changes which can be easily accessible to the people from the local council. Clements, 2014. It also requires effective communication between the partners by firmly establishing that all the parties are talking to each other as well as having service at heart. 1.3 Evidence-based research for identification of best practices in the person-centered and outcome-based practice. The best practices in the person center and the outcome-based practice of health assistance for an adult require the carrying out of regular checks for safeguarding and ensuring that the best practice is being implemented. The staff must not be under any sort of illusion in their role of completing the records and the paperwork accurately and identification of the issues of concern. The best practices also require an efficient decision-making process by setting the goals of the managers. This requires consideration of the regular feedback from the staff, family members as well as care professionals who are part of the multidisciplinary team, and early setting the feedback regarding the performance of the service with respect to daily activities of living. 1.4. Identification and acting on lessons learned from the incidents that occur. Some of the incidents that may occur in a domiciliary care organization are related to health and safety, such as failure to provide care in accordance with the care plan may result in harm or neglect of the client. For example, if a care worker does not administer medication correctly or report a change in the client's condition, it may cause adverse effects on the client's health and well-being. Injury or illness of the care worker due to incorrect use of equipment or materials, such as gloves, hoists, or sharps. For example, if a care worker does not wear gloves properly or does not dispose of sharps safely, they may develop dermatitis or contract an infection. Damage or loss of equipment or property due to poor maintenance or handling. For example, if a care worker does not check the battery of a hoist or does not secure it properly, it may malfunction or fall and cause injury to the care worker or the client. Legal or ethical issues due to non-compliance with legislation, regulations, codes of practice, or policies and procedures. For example, if a care worker does not respect the client's privacy, dignity, or consent, they may breach the Data Protection Act, the Human Rights Act, or the Care Act. It is essential to identify and act on lessons learned from these incidents to prevent them from happening again and improve the quality and safety of care. Some of the actions that can be taken are reporting and recording the incidents accurately and promptly using the appropriate forms and systems. Investigating and analyzing the causes and consequences of the incidents using root cause analysis or other methods. Implementing and monitoring corrective and preventive actions such as training, supervision, feedback, audits, reviews, or changes in policies and procedures. Sharing and learning from the incidents with other staff, clients, families, or other professionals using meetings, newsletters, bulletins, or case studies. Evaluating and reviewing the effectiveness and impact of the actions taken using indicators, measures, or outcomes. Scan the QR code displayed to access and download the free assignments. For Unit 10, DILMAC 5C Continuous Improvement in Adult Care, we have carefully gone through L5 assignment details and assure you that all the requirements will be met, and the assignment will help you get good marks and high grade. Following are our 6 exclusive features. 1. 3,000 plus words. 2. Plagiarism-free work. 3. High-quality assignment. 4. Reference list. 5. PhD experts and writers. 6. Free bibliography.